I am Dr. Sanjeeva Rao Girimaji, Consultant Physician at Apollo BGS Hospital, Mysore. Today let's know about some of the effects of the most commonly abused substance, the tobacco. You know, tobacco is consumed in three different forms, either through smoking or through inhalation, what you call as snuff, or chewing tobacco. Tobacco is a drug that not only affects the person who is consuming it, but also affects the person who is around him. It has got multitude of side effects, multitude of problems. So let's categorize them, how it affects. Tobacco smoke contains almost about more than 5,000 different combination of chemicals, almost 70 out of which can cause cancer. And the person who inhales this, not just the smoker, even the other person standing by who inhales the smoke, the passive smoker or the second-hand smoker, he is also at risk. So it has got two, we can broadly categorize it into two categories. One is the immediate effect. Immediately after smoking, there is a higher tendency for the platelets to clump together and form clots. This can lead to heart attack and strokes. It can cause inflammation of the lining of our oral cavity, nasal cavity, or the windpipe and the foot pipe, causing inflammation leading to pain and increased risk for infections. Smoke also destroys what is called as a villi, which helps in clearing out the dust gathered in the that we inhale from the air, and resulting in increased risk for infections in the chest. Tobacco smoking also can cause, or tobacco consumption can cause, mutation of the genes or affect the genes in such a way that the patients are at an increased risk of developing cancer and other diseases. So categorizingly, the patient who consumes tobacco in whichever form is at increased risk of developing eye problems like cataract. It can cause blindness. It can cause increased sinusitis, risk of nasal infections, sinusitis, pharyngitis. It can cause cancers of the oral cavity. It can cause damages to the teeth. Can cause cancer of the foot pipe or the windpipe, both. It can cause lung cancers. It's also the stomach cancer can also be caused by these. Also the intestinal cancer, the cancer of the pancreas, the urinary bladder cancer have all been attributed to tobacco. Tobacco consumption also causes increased risk for cardiac diseases and increased risk of stroke. It is said that even a single cigarette reduces the lifespan of a man by about 14 minutes and that of a female or a lady by about another 1 minute extra, that is 15 minutes. And an average lifespan of a smoker comes down by about 10 to 11 years because of this habit. So it is best that people quit smoking tobacco or consuming it in either chewing or the snuff form and then lead a healthy life. Thank you.